What had happened was I had a tooth on the bottom in the front go dead and created an infection. And my general dentist, we cleared the infection up, but then I was told that it would have to come out. And we talked about different things that we could do to replace it, and some I liked and some I didn't. And so we talked a little bit about putting possibly a bridge in, and I wasn't happy with that. So then he sent me to Dr. Faiella because he thought we could do an implant. He was really very kind, very sympathetic with what I was dealing with. And he initially said that I couldn't do an implant because of, and I don't truly remember the reason, I have to be honest. I think it was because I didn't have bone here, but it also, your 4 bottom teeth are small, and it would mean they all had to come out.
Well, the solution initially was to be considered was an implant-supported fixed bridge for the lower anterior. Upon obtaining the CT, there was not enough bone thickness to be able to place the implants. They were extremely thin. The anatomy was not amenable to a block graft, and it looked as though she could not have an implant option. So the second option was a fixed bridge from canine to canine, and that was the procedure that was to be effective. Unfortunately, when the dentist looked at the position of the canines, he didn't feel that it was amenable to a fixed bridge and the path of draw for the prosthesis. So he came back and asked me to look again about any possibility to try the implant option. And so we took another look at the case and decided to proceed with attempting an implant restoration.
Once we agreed that he could do an implant, I was fine with it. It really made me happier, because I knew when it was done, it was permanent. And so he explained everything that would happen, how he would put the bone in, and we'd have to wait 4 to 5, maybe 6 months for it to grow. And then he would open it up after that period of time, and if everything was right, he was going to put the posts in. So he did, and he got one of the posts in, but the second post wouldn't stay in, so he had to add more bone. He had to close it up, and I had to wait another 4 months for that to harden and grow some more before he could try again.
The approach was to take this extremely thin ridge and actually split the ridge so that we can expand that ridge to add a little bit more width with bone grafting in between, allow that to heal, and then place the 2 implants following that split. That was performed. The first time, one of the implants, because the bone on the facial side was extremely thin, did not integrate. The other one did. She was very disappointed because obviously she could not have the fixed bridge with just 1 implant alone. So we proceeded to go ahead and regraft the site at no fee to her because I wanted the outcome to be what she was expecting. We grafted that site, it healed beautifully, placed the implant, healed beautifully, and she wound up with the fixed bridge that she wanted all along, and not to affect the 2 adjacent natural teeth.
I feel whole again. I feel like my mouth is good. When I smile, you don't see those teeth, but I know they're there, and I know the comfort that I have with eating. That's the main thing. You can bite into things. You can't bite into things when you're wearing a flipper, or you have to be more careful. So I don't know what to say except that I'm really happy with it. I really am. It changed my life back to what I used to have when I had my regular teeth.